Meningococcal B is an aggressive bacterial infection. It spreads rapidly in close contact environments, and once it takes hold, it carries a 10% fatality rate. Since 2015, infants in the UK have received routine MenB immunizations, but the current cohort of teenagers missed that initial rollout, leaving a distinct gap in the population's immune defense. That gap became a serious issue in early 2026. A fast-growing outbreak of MenB originated in Kent, exposing this exact demographic vulnerability. Now, roughly 1 million Year 13 students and university freshers are preparing to migrate into shared accommodations and dormitories. These tight living quarters are exactly where the bacteria thrive. This collision of a missing pediatric defense line and high-density student living creates a strict deadline. Public health officials have to build a protective shield before the autumn term begins. Vaccinating 1 million young adults in a few months presents a massive logistical hurdle. Traditional general practices and hospitals lack the spare capacity to process that volume on short notice. To solve this, the NHS activated its community pharmacy network. By commissioning a new advanced service, they turned local high-street pharmacies into a decentralized vaccination grid. It requires converting everyday medication dispensaries into high-volume clinical pipelines practically overnight. Halting a biological threat at this scale is an engineering problem. The infrastructure has to be built from the ground up, fast enough to beat the start of the academic year. The first major operational roadblock is legal. The required vaccine, Bexsero, is a prescription-only medication. Normally, a doctor has to individually sign off on every single dose. To clear this, the NHS relies on a patient group direction, or PGD, allowing trained pharmacists to administer the dose without waiting for an individual prescription. By transferring authority directly, the PGD entirely removes the GP bottleneck, unlocking full processing power. With the legal route open, the NHS uses digital targeting to find the patients. Eligible students receive direct notifications through the NHS app and text messages, routing them straight into the National Booking Service. To keep this pipeline flowing, participating pharmacies must maintain a minimum capacity of 100 available appointments per month. Combining targeted digital routing with the PGD framework bypasses traditional medical bureaucracy, providing the mathematical solution required to process 1 million patients at speed. The physical supply chain is tightly controlled. The NHS centrally procures the 4C MEB vaccine and ships it directly to participating pharmacies in packs of 10 pre-filled syringes. These shipments are bound by strict cold chain logistics. The vaccine must be stored continuously between 2 and 8 degrees Celsius right up to injection. Delivering the physical dose is only half the process. A single injection is insufficient. 2 doses are absolutely essential to provide full protection. This 2-dose requirement creates a strict operational timer. The immune system requires a 28-day gap between doses. Since the program shuts down in March 2027, this timer forces a hard deadline. The first dose must be administered by December 31st. These rigid dates are not arbitrary bureaucratic choices. They are entirely dictated by the thermal vulnerability of the vaccine and the biological processing time of the human immune system. Once a vaccine is administered, the data is immediately logged into the RAV's clinical system, which automatically updates the patient's registered GP on the same day. Simultaneously, this real-time data flows to the UK Health Security Agency, allowing them to track how MenB is behaving across this specific student demographic. To drive this rapid pivot, the financial engine offers pharmacies a £10.06 fee per administered dose, along with fixed bonuses to cover operational setup. Zooming out, this one-off program demonstrates that community pharmacies operate as highly capable, rapid-response public health hubs. When facing sudden, localized biological threats, this decentralized network provides a highly effective, plug-and-play logistical defense shield for the community.